Hi, my name is Dr. Tulorin. I'm a hostelist at Sovah Health in Danville. I became a physician to care for our most prized asset, our health. At this time, with the coronavirus COVID-19 spreading in our communities, it is of great concern to me, and that's why I'm grateful for this opportunity to share with you current prevalence in our hospitals and also give some guidance about what we can do individually to help limit the spread of this virus. At this time, between Danville and Martinsville, we have roughly 40 patients with coronavirus COVID-19, and this is split evenly between both campuses. Now, this represents an increase from prior weeks, in our community. As a result of this, we've had to limit our visitation policy, to the hospital. We've had to, try to curtail the number of people that come in to see their loved ones. Now, we do have some exceptions under which families can come in to see their loved ones. And please, to learn more, visit our website, sovahhealth.com. We have a detailed description of our visitation policy, and please reach out to us if you have any questions. We understand that this is difficult for you and your loved ones, and we are doing our best to help improve the experience and what we can do. However, we have to work together to help limit the spread of the virus in our community. And now that brings us to what can we do? As you know, the virus is spreading, and there are certain best practices that we can all adopt in order to limit the spread within our community. First thing is we have to limit contact, which is social distancing. When you are about to go out to visit a friend or to go into the community, ask yourself, will I be able to social distance in that setting? Social distancing, at least keeping 6 feet apart to minimize the transmission from one person to another. Do your best to do that in whatever setting you find yourself. Next, are you able to wear a mask? As you can see, wearing a mask has become policy really across the nation to help limit the spread of the virus. It's effective, it helps save lives, and please, we appeal to you to do it for us, do it for your loved ones, and also do it for yourself. We have to help each other to overcome this virus. Then the other thing you ask yourself, am I able to limit the amount of time I spend in that environment, especially if it is indoors? If you're in an environment that is enclosed indoors, for a long period of time, it increases the risk of transmission. So if you can, choose to be outdoors. When you're in a large gathering or in a gathering of people that you're not familiar with, outdoors is preferred because you have great circulation, you limit the spread of the virus. And of course, as we all know, wash your hands. Wash your hands as often as you can. Try to limit the surfaces that you contact, and if you cannot wash your hands, use your hand sanitizer. Again, we need to help each other to overcome this pandemic, and these are some of the basic things that we can do together to limit the spread of the virus. Now, very important, if you do have symptoms, you have a headache, you have a fever, you have sore throat, you lose sense of taste or sense of smell, you have trouble breathing, please reach out to the hospital, reach out to your physician, let us know about it, let us evaluate you, and let us care for you. What we also know is that early intervention, early evaluation is very important so that we can provide you interventions early, especially with the coronavirus pandemic. Now, we also know that if you have chronic conditions like diabetes, hypertension, and COPD, you are at increased risk of having severe infections from coronavirus COVID-19. And so therefore, if you have these conditions, we also appeal to you to reach out to your physician, make sure you have your medications, make sure your condition is well managed, and also make sure you get the appropriate preventive care, get your vaccinations as well. And to do this, again, we ask that you reach out to your physicians, let them know about your concerns, and you get appropriate care. Again, we just want to reassure you, the hospital is here for you. We're here to care for our patients and our community. If you have any concerns, you have any questions, or you just want to have a conversation, please reach out to us. We're here to care for you, and together we can overcome this pandemic. Thank you very much.